Read updates in Chinese. An American woman who disembarked from a cruise ship in Cambodia, after the vessel was refused entry at ports across Asia over fears of a coronavirus outbreak, was preliminarily found to have the coronavirus on her arrival in Malaysia, health officials there said. But the cruise line, Holland America Line, said that the test was inconclusive, and Cambodia called on Malaysia to conduct further testing. Malaysia's announcement on Saturday that the 83-year-old had contracted the virus prompted concerns that other passengers who had left Cambodia for their home countries could be infected. The ship, the Westerdam, was denied entry by 5 countries over 2 weeks for fear that passengers might be carrying the disease, even though the cruise line said no cases of the virus had been found aboard the vessel. Cambodia eventually agreed to accept the ship, and it docked in the city of Sihanoukville on Thursday. Cambodia's Prime Minister, Hun Sen, and the United States Ambassador, Patrick Murphy, were on hand to welcome the passengers ashore. Updated February 10, 2020. Malaysia's Ministry of Health said that the woman and her 85-year-old husband showed symptoms of coronavirus when they arrived at Kuala Lumpur International Airport. Both were tested for the disease, and he tested negative, the ministry said. Both remain hospitalized. The Westerdam, carrying 2,257 passengers and crew, departed from Hong Kong on February 1 and was at sea for nearly 14 days, the time frame that is believed to be the maximum incubation period for the highly transmissible virus. China reported 2,009 new cases of coronavirus and 142 associated deaths in the previous 24 hours on Sunday, days after the government changed the criteria for how it tracks cases. In all, more than 68,500 people have been infected and at least 1,669 have died worldwide, officials have said. The vast majority of cases, and all but a few of the deaths, have been in mainland China, with the heaviest concentration in Hubei province, the center of the outbreak. Even as the death toll mounted, the fatality rate remained stable, and the rate of new cases has slowed in the past 3 days. That decline in new cases follows a spike of more than 15,000 on Thursday, when the government began counting cases diagnosed in clinical settings, including with the use of CT scans, and not just those confirmed with specialized testing kits. The virus has infected more than 69,200 people in China and 25 other countries. Under fire for its initial response to the coronavirus epidemic, China's authoritarian government appears to be pushing a new account of events that presents President Xi Jinping as taking early action to fight the outbreak that has convulsed the country. But in doing so, the authorities have acknowledged for the first time that Mr. Xi was aware of the epidemic nearly 2 weeks before he first spoke publicly about it, and while officials at its epicenter, in the city of Wuhan, were still playing down its dangers. That new account risks drawing the president, China's most powerful leader in decades, directly into questions about whether top officials did too little, too late. In the newly released internal speech that Mr. Xi delivered on February 3, when the epidemic had already spiraled into a national crisis, the Chinese president said he had issued demands about the efforts to prevent and control the coronavirus on January 7, during a meeting of the Politburo Standing Committee, the highest council of the Communist Party, whose sessions are typically very secretive. In the speech, he also said he had authorized the unprecedented lockdown of Wuhan and other cities beginning on January 23. I have at every moment monitored the spread of the epidemic and progress in efforts to curtail it, constantly issuing oral orders and also instructions, Mr. Xi said of his more recent involvement. Mr. Xi's advisors may have hoped that publishing the speech would dispel speculation about his recent retreat from public view and reassure his people that he can be trusted to lead them out of the epidemic. But the speech could expose Mr. Xi to criticism that he didn't treat the initial threat urgently enough, and make it difficult for him to shift blame onto local officials. In early January, leaders in Wuhan, the city at the epicenter of the outbreak, were giving open assurances that there was no clear evidence of human-to-human transmission. Research and reporting was contributed by Richard C. Paddock, Sun Naran, Russell Goldman, and Amy Cheen.